are joining us today, it is likely because you or someone you know, whether that's your child or perhaps students you work with, are interested in a career in nursing. You probably have questions about what the difference is between an HCA, LPN, and RN, what those pathways to each of those roles looks like, and what post-secondary programs might be a good fit for you. Well, we do have some fantastic folks on the call from Lethbridge College, Medicine Hat College, and Red Deer Polytechnic who are here to give you some insights on just that.
Welcome, everybody. I'm so excited to see that we have lots of participants today. So I'm glad you're kind of thinking about nursing. I think there's so many great things about nursing, and there's so many different things you can do as a nurse. So hopefully you'll get a little bit of that information as we move out for the evening. So a little bit of my story of why rural. I grew up in rural Saskatchewan. I'm a rural girl at heart. My family still all lives back in rural Saskatchewan, so I will always be a rural girl. I have lived in the city at different points in my life, but definitely it has not been for me. So I was excited to move off the farm initially when I graduated from high school. I was like, I'm going to go to the city and it's going to be great. And I got there and I went to school and it was scary. And I met lots of great people though. And I knew at that point that I probably wouldn't be a city girl for long, but I needed to go there to get my education as a nurse. And so that's where I started. At that point, when I was finished my nursing degree in Saskatchewan, my husband and I moved out to Alberta just to try something different. We moved into Calgary. Well, that's a huge city compared to the 700 person town that I grew up in. And it was a bit overwhelming. However, I did learn a lot as a nurse at the Foothills Hospital. I worked in cardiac care for a short time. So cardiac care is focused on people that have heart problems. So I really enjoyed that. I learned a ton, but I knew that I wasn't going to stay there forever for sure. My husband and I quickly moved out of the city into a rural community just outside of Calgary not long after that. Fast forwarded a couple years and I accepted a position at Didsbury Hospital, which is a small community here in central Alberta. I learned so much there. I had the opportunity to expand my nursing skills. I took some trauma courses, I took some emergency care courses, and I got to see a variety of different types of patients in that little rural hospital. When I worked in Calgary at the Foothills, I was really just focused on one type of patient, but the experience in rural gave me the opportunity to see different types of people. And I really enjoyed it. I loved the community. I got to know people. It'd be the same people coming back to the hospital all the time. So I really got to know the community, and that's me at heart, is getting to know people. Since then, I've been lucky to have worked at Olds Hospital, where I live in Olds now. I love Olds Hospital. That expanded my skills even more. They do labor and delivery there as well, and have a really thriving emergency department there. I'm lucky enough now to be a nurse educator, and I bring nursing students to Olds all the time. They love coming there. They love the experiences they get to see there. I've never had one student tell me that they didn't like the experience. They always love just the variety of patients they get to see. They get a little bit of everything there. They also get a little bit of operating room nursing there because we have a thriving operating room there, and some day surgery as well. So there's a variety of things to see. And I would say, even though I'm a nurse educator full-time now, I'm always a rural nurse. I'll always be a rural nurse. And I highly recommend anybody that wants to try it, that you should always just give it a try. And you're just in high school now thinking about nursing, but you'll probably get the opportunity at some point in your practice to do a practicum. And I highly suggest during that practicum time to go and try out a rural setting and see what you think of it. I have no doubts that you'll love it. So thank you.
Amazing. Thank you so much, Erin. So we did have a previous session where we heard a little more from nurses like Erin. And if you are interested to hear a little bit more of those stories, if that piqued your interest, because it does mine every time I hear Erin. It's just so interesting to hear these lived experiences. Please connect with me, and I'd be happy to send you that recording link. So we are going to move on now that we've heard a little bit about why rural. I'd like to introduce our post-secondary speakers. So they know in what order we're going to go, but I'll just kind of introduce them all at once here. So we've got from Lethbridge College, we have Liz Cernagoy and Loretta Croker. Joining us from Medicine Hat College are Carol Bajorquez, Erin Murdoch, and Kate Squires. And we have Victoria Stewart and Kelsey Dubé from Red Deer Polytechnic. So I am going to turn it over to our Lethbridge College speakers to give us a little bit of insight onto their programs.
Thank you. I'm going to start off the Lethbridge College presentation, and my colleague Liz is going to join in on the presentation. So I'll let her kind of click through the slides as I chat with you. We in Lethbridge College are fortunate to have the diploma program and the degree program, and Liz and I are both chairs, and we work closely together and have a really wonderful collaborative relationship with both programs. I think doing a good job of getting nurses ready for what's out there. So I'm going to kind of run through about the diploma, and then Liz is going to follow me to talk about the degree program. So I guess we can move on. I just want to give greetings from Lethbridge College. We're definitely in the South Zone, right close to Medicine Hat there, a little bit west. And our campus is growing and thriving, and the nursing programs definitely are an important hub with that campus. So Lethbridge College has a mission statement, and the nursing programs, we support this and we actively work to ensure this mission statement is in place in our programs to inspire and facilitate learning and innovation. And we definitely want to focus on meeting the economic and social needs of the community, and we want to lead and transform education in Alberta. So both programs, we're looking at opportunities of where we can meet that mission and that vision for Lethbridge College. So I'm just going to speak on the practical nurse program. It's a 2-year program with the 5th term being the preceptorship. We also have a refresher program that we offer online for nurses who've been out of practice and need to refresh and get back in the program. I'm going to kind of run through what our overall objectives are. So we definitely have seasoned instructors. There's quite a bit of hands-on training from simulation to the clinical, and we really want to facilitate critical thinking within nursing just to ensure that the care we provide is safe and competent and ethical. So we integrate the clinical experience into our education just to prepare our students for the nursing profession. So this is an instructor in our program, and really our goal is to try to shape the future for nursing and have the best prepared entry-level nurses we can get out there in this really critical time in healthcare. In considering the diploma program, it's quite a full program. We have clinicals each semester, and each one has a rural opportunity, which we really value. So we use sites like Tabor and Claresholm. And I would have to agree with what Erin said, is that our students greatly appreciate the opportunity to go to the rural sites. And I would agree that I just never hear a bad word about going to the rural sites. They love the diversity, they love the experience. And so within the diploma program, you have the specialty courses, your fundamental nursing courses, and definitely support courses with general studies. So it is a very full 2.5 years, but we find that our students are ready to face what is out there. I did want to say, I actually graduated, I attended, nursing schools used to be in the hospital. So we actually lived in the hospital. We wore nursing caps, and it was in the 80s. And so I actually trained in a very large hospital in Northern Alberta in Edmonton. And we had the opportunity, my husband and I, to move to a rural community. So I came from a hospital where, you know, there was many different disciplines working. And so we went to the rural hospital, and very quickly I developed a strong love and appreciation for rural nurses. Everything that I saw go through the emergency doors in the big city hospital, we experienced in rural nursing. So the challenges were there. I think rural is the heartland of Alberta, and within that heartland of these rural settings is the hospital. And it really is a hub to support the families and the community members. It's actually extremely rewarding. But I have to tell you a funny story. So I went from the big city hospital, I got my patient prepped for the OR, And I went to the nursing desk and I said to them, I said, you can call the porter. My patient's ready to be transferred to the OR. And the whole desk erupted in laughter. And I said, let me guess, I'm the porter. And they said, you are. And I really realized that rural nurses are incredible. And the diversity, a laboring patient to a patient on a nitro drip to everything that you would see in the large city center, the rural nurses did a tremendous job. And it's just really rewarding. So I'm thankful for this action plan. I'm thankful that you're considering rural nursing. And for me, it was probably one of my favorite times in nursing was being in that rural community. So I'll pass it to Liz.
Thank you, Loretta, for getting us started and speaking about your own experience with rural nursing. So welcome everyone. Oki, we're joining you here from Lethbridge, Alberta, and we're a smaller city in Southern Alberta, and we have many less than 15,000 communities that we service here in Lethbridge as well. So many opportunities to connect rurally. So we have two Bachelor of Nursing programs here in Lethbridge. We have a 4-year degree program, as well as a 24-month after degree program. I've had the opportunity to work closely with students in both programs, and both programs have similar values, philosophies, and approaches to supporting students for success. Our purpose in the NISA-BN programs is to prepare our students to engage in caring, relational nursing practice with people and populations across settings, with the goal of promoting health, healing, and wholeness. We launched our new curriculum in the fall of 2020 for our 4-year students, and just this past fall for our after degree nursing students. So we have many new contemporary nursing concepts that we've included. And in each of our courses, students get exposure in that same semester to theory and lab experiences. And in the first year of our program, also get the opportunity to go into practice settings. We treat our students as emerging professionals and provide leadership and advocacy opportunities within the interprofessional care team and the larger healthcare and social systems. And just as Loretta mentioned, we have highly experienced nurse educators that work closely with our community partners to try to give you the best possible experience during your nursing program. You'll see in our new curriculums that I'm talking about today, we have incorporated many of the new intersectionality and cultural components that are needed in today's society. This is one of our Blackfoot grandparents from Lethbridge College who supports our students in all of our programs as they journey through Lethbridge College. So our programs in the Bachelor of Nursing are offered in collaboration with the university. So students will spend the first part of their program on our Lethbridge College campus and the last part of their program at the University of Lethbridge. And when they graduate on their diploma and degree, they'll have, again, on that parchment, both institutions' logos. So this is our traditional 4-year program that I'm going to talk about tonight, just to give you a glimpse of what those courses will look like and what the sequence of programs kind of unfold as. Our after degree program is compressed over 24 months, but has many of the same courses. So in year 1, our students focus more so on self. They learn about important components like rural nursing practice, intersectionality, the scope of the registered nurse. And in the second semester of first year, have the opportunity to spend more time in the labs and go into their first clinical placement. That's a strong value we have in our Bachelor of Nursing programs, is that we're providing students the opportunity to practice right from the beginning of their nursing program in year 1. In year 2, this is when we have those rural opportunities for all of our students. So all students will do a Praxis with Persons clinical, where they'll go for 6 to 7 weeks to one of our rural communities in Southern Alberta. That could be as far away as Crow's Nest Pass or Pincher Creek. Some of our closer locations are in Claresholm, Raymond, Tabor. And just like Loretta said, students have found this really valuable and speak highly of the diverse patients they have in these clinical settings. Today, I'm joined by 2 of our Bachelor of Nursing students that will also talk about their experiences in rural in the fall as part of their second-year courses. They'll also take a variety of other courses in the second year of their program with Health of Families, their social science courses and support courses as they progress in the program. And that focus really is on individuals and families in the second year of our program. In years 3, they're going to move to more of a community focus when they take their mental health courses and community health courses at the university with our practice partners as well. And then in 4th year, their focus will shift to more of a global view, and they'll do a medical surgical rotation towards the end of their time in our program, and a final preceptorship of 350 hours. In the mental health rotation, as well as in the community health rotation, they may have an opportunity to go rural again. And for final preceptorship, students can provide their top 4 choices of locations they would like to spend their 350 hours at the end of the program. And rural is always a popular choice after students have had that early experience in the nursing program to return to and specialize in, and potentially have their first job in after graduation. So I have 2 student testimonials that have been shared by our students that you'll be hearing from later today. The first one is from Georgia. She's a 2nd-year Bachelor of Nursing student who had the opportunity to go to Cardston for her clinical placement back in the fall. Her words were that she really loved having a rural rotation within my nursing education. I got to see and care for a broad range of patients that developed my skills and confidence. Rural nursing allowed me to learn from multiple disciplines in healthcare and try different specialties of nursing, which I am thankful for. And she'll tell you more about her experiences later in our evening tonight. And then second, we'll be joined by Eva Wiebe, who's a 2nd-year Bachelor of Nursing student who had the opportunity to go to Tabor back in the fall for her rural clinical placement. Her words was that she lives in Tabor and commutes into Lethbridge College while I'm pursuing my Bachelor of Nursing degree through the NISA program. I had the opportunity to complete my rural medical surgical rotation in Tabor last semester, which I truly enjoyed and gave a glimpse of what rural nursing entails. My experience as a student in Tabor showed me that as a nurse, working in a rural area, you really have the potential to work to your full scope of practice. So I want to reiterate that we have a supportive learning environment for our students here in Southern Alberta for you to grow and expand in your future career if nursing feels like the right fit for you. In particular, I'm so excited to hear about all the different rural initiatives happening in the province of Alberta. And just like Loretta said, there's so many opportunities ahead of you in your future career. These are former students and professors at Lethbridge College. And again, we're helping to propel you to success in your career when you write your final NCLEX RN and enter the profession. Any follow-up questions you might have, I've listed in here our recruitment email, as well as both myself and Loretta's email contacts. And I'll be staying on the call for any Q&A that comes up later tonight as well.
Perfect. Thank you so much. We do have one quick question that I think can be answered very briefly. And so it says, do you apply for the 4-year program through the university or the college?
A great question. So it is through the University of Lethbridge that you apply, and then we work closely with the admissions departments between both campuses to coordinate the first 2 years of your program and your start.
Well, thank you, Liz. And I'm not sure if Loretta's still on the call, but either way, thank you so much for both of you to speaking. There you are, Loretta. So thank you so much. It was very appreciated. Great information. And I'm going to take home all kinds of good stuff today. So we are going to move to Medicine Hat College. We have some great speakers there. So I'm going to turn it right over to you guys.
Hi, everyone. I'm going to share my screen here. Excellent. Well, I'll quickly introduce myself, and then I've got some colleagues who are going to speak as well. So my name is Erin Murdoch, and I am the chair of all the health programs at Medicine Hat College. And tonight we are coming to you from the nursing perspective. So we're going to speak about our healthcare aide program, our practical nurse program, as well as our new Bachelor of Science in Nursing program. So without further ado, I will hand things over to my colleague, Carol.
Hello, everyone. Thank you for taking the time to attend this session and for providing the space and the opportunity so we can share some information of the health-related programs that Medicine Hat College has to offer. My name is Carol Bojorquez, and I am a registered nurse for about 20 years now. I am currently the coordinator for the healthcare aide program at Medicine Hat College. So first of all, what is a healthcare aide? We've been, like hearing about nursing, and but we also have another healthcare professional, which is the healthcare aide. But what is a healthcare aide? Well, a healthcare aide is an unregulated healthcare professional that has received a certificate from the government of Alberta. These professionals work in many different settings, provide direct assistance to patients, to clients, and residents. So we know that as people age or face illnesses or disabilities, they may need the support from caring professionals that not only have the knowledge and the skills to provide care, but also have the compassion and possess the attitude to provide that care that is needed. So the healthcare program offers, like the healthcare program offered at Medicine College consists of 9 courses delivered over a period of 8 months. This, and if we can move to the next slide, Erin, this includes lectures, labs, and different clinical experiences. So the first 2 clinical experiences are instructor-led experiences that, like basically students can go to any long-term care facility, home care, institutions within Medicine Hat or Brooks, but the instructor is with the students, during the whole clinical. Now, when we move into the last clinical, which is 80 hours, this is when students have the opportunity to choose to go to a rural placement. We have had students going to Tabor, to Oyen, to Bow Island, depending where their interest is. So the program is also offered at Medicine Hat main campus. And if we can move to the next one. Thank you, Erin. The program is offered at Medicine Hat main campus with 2 intakes, one being in September for the fall, and the next one is in January. And we also have the option of, students, taking this program in Brooks. In Brooks, the intake is only in September, and it's an in-person delivery. In Medicine Hat, we do have the option of having students attending classes online for those students that maybe are working or would like to maybe review lectures. They're not able to review their lectures, at a specific time during the day. They do have the option of reviewing lectures, outside of office hours. So we do have two options. And we also have the dual credit during high school. So that's something that, right now is being worked with Prairie Rose. And, it's a great opportunity for high school students. High school students can actually finish, a few courses before they finish high school. And then once they graduate, they can come into Medicine College and complete the program. I find that sometimes students, when they are not quite sure, what type of career they want to take, but they know that they want to choose something in healthcare, or maybe they need to do some upgrading to go into those nursing programs. They may choose to do the healthcare program first, so they can get, a real experience, of working with clients, with patients. And then after that, they have the opportunity to work as a healthcare aide, earn a little bit more money while they get their upgrading done, so they can move on into or join another program like the practical nurse program or the Bachelor of Nursing program. So, if you are considering joining the healthcare program, well, it is important to know what do you need, right? So the program entry requirements are very simple. English, academic English language arts. So English, we can accept English 20-1, 20-2 with a minimum passing grade of 60%, and English 30-1 or 30-2 with a passing grade of 55%. For those people those candidates that English is not their first language, of course, they need to provide a English language proficiency test, which we have different methods of assessment for to provide this, comply with this requirement. And also digital literacy, because, every student joining the healthcare program must have knowledge of computer technology, all those tools that are needed to be successful in the program, such as, using the computer, searching the web, sending an email, logging into portals, and those type of things that I think that after COVID, most of our high school students are quite efficient in accessing. So other than that, I'm very excited of, working in the healthcare aid program. If you have any questions, particularly about this program, please don't hesitate to send us an email or just ask us at the end of this session. We do have a guest student. She is currently in the healthcare aid program, and she will be sharing a little bit about her experiences in the program at Medicine Hat College. Thank you very much.
Great. Thanks, Carol. Next, we're going to move on to a description of our practical nurse program, and I'll hand it over to Kate.
Hi, everyone. My name is Kate Squires, and I am one of the coordinators for the practical nurse program. I work at the main campus in Medicine Hat, and I'm really lucky because I've had the opportunity to work in healthcare aid, practical nursing, and now I'm working in the Bachelor of Nursing program in Medicine Hat as well too, and actually teaching the rural theory program, the rural theory class there, which has been really good. So at Medicine Hat College, we have the opportunity to, we have the two campuses where we offer the practical program through. So we've been offering it at the Brooks campus for about 25 years now, but this has been our first winter intake where we're doing it at the main campus as well. So as you heard before, LPNs are professional nurses that work within their own scope of practice. They have their own standards of practice and code of ethics. And LPNs have specific skills and abilities that contribute to the continuum of care here, from prevention to acute care treatment, management, long-term, and palliative care. The scope of practice for the LPN, specifically in the last 10 years, has really increased, and our program right now is currently 20 months. So our delivery method options here in Medicine Hat, like I said, we have our first program going for the first time. We begin this cohort in January, and they run through till about the middle or end of September or beginning of October. They have a break and then return after Christmas. Or in Brooks, it runs on a more traditional format where they begin in September and they finish up around June for both times during the year there. So what you can expect here, similarly to a lot of the other nursing programs, we have our foundational nursing classes that are also supported by communication, psychology, anatomy, and physiology. And then we get into specific nursing skills. We add on nursing labs with them as well. And throughout the program in the 2 years, we do have the opportunity to have some clinical placements, many of them completed in the rural setting. And students have really enjoyed these in the past. And we often get the comments when they're in the rural setting, they get to see a lot of different roles and responsibilities in places in the hospitals that nurses have the opportunity to work that they don't always get to see when they're in some of the bigger centers. We have a really great simulation program that's just increasing all of the time that they're really enjoying as well. The other thing with the flexibility of it being offered 2 different times in the year, the students are liking that they can do what fits better to their individual lifestyle. So if I was looking to begin enrollment here, I would recommend attending one of our open houses if you have the opportunity to do that. They're offered 1 to 2 times depending on the year, and you can come in and have a look at our facility, meet some of our students, check out our labs, and just kind of learn what kind of nursing or healthcare aid, practical nursing might be a good fit for you. They also provide a really great option here that they waive the application fee if you're in person and complete it on that night. The other things here too, if I was looking, I would want to try and focus on my biology and my English and that kind of thing, because right now we accept a 30 in biology. Oh, sorry, we need biology 30, English 30-1, or English 30-2, and math 20-1 or math 20-2.
Awesome. Thanks, Kate. It's really exciting to have our new cohort that just started in January. So we've got a brand new practical nurse program in Medicine Hat, and it's a really exciting time. So we're excited to have a whole bunch of new folks with us. And the last program we're going to talk about is our brand new Bachelor of Science in Nursing degree that we have in Medicine Hat College. So currently we do offer a 4-year degree. It's our Bachelor of Nursing degree with the University of Calgary, but we're rolling out a brand new curriculum starting in September, and we're terribly excited and hope that you can be a part of it. So really, what is our nursing program? Well, ultimately, we know that nurses play a really important role in our healthcare system, and it's their knowledge, their skills, and compassion that are in demand all across the country, especially in rural settings. So with our Bachelor of Science in Nursing program, It's a collaborative degree with the University of Calgary. So what that means is you can take your entire 4-year degree in Medicine Hat, but you will actually graduate with U of C credentials on your degree. So just like at Lethbridge College, you'll see Lethbridge College and the university on your parchment. Same thing for Medicine Hat. You'll see our logo on your parchment, but also the University of Calgary. And it is a 4-year program. So what can you expect in these 4 years? Well, very similar to what Lethbridge described and my colleagues described at Medicine Hat, you're going to have a combination of many great experiences. It's going to start with theory classes. We also have labs and clinical placements, and I'll describe those in just a second. And I might even get Kate to talk a bit about the rural course that she teaches, just to give you a taste of what specifically we can offer you at Medicine Hat College. So in our brand new program that we're rolling out in the fall, what are you going to get? Well, in year 1, you're going to do a lot of your support courses. So that's going to include anatomy and physiology, which is really close to biology, and English and sociology and other things that'll help support you and your thinking throughout the degree. And brand new, we're offering an introduction to nursing course. So learning all about the history of nursing and where nursing is going, as well as a brand new Indigenous course looking at Indigenous health perspectives. So really exciting. Second year, you're getting right into clinical placements. We're sending you out into a variety of places such as the community. So you might go to community clinics or different things that are happening in your local rural town. We're going to go to long-term care. So looking after a population that needs a little bit of specialized care, where you'll see a lot of healthcare aides, like from Carol's program. And we're also getting students into the hospital for the first time. So really exciting. You're spending at least half of your year, not just in class, but actually out practicing in the clinical site. Coming into your 3rd year, we focus a lot more on hospital care and acute care. And then we're actually going into a variety of settings between 3rd and 4th year that include not only mental health, but perinatal, so moms having babies, pediatrics, and a specific rural focus as well. And maybe, Kate, do you want to tell everybody what is involved in the rural course that we currently have that is just so wonderful?
So I was really lucky to start teaching this course last year, and I was so excited when I was preparing it because it really reflects well in with my background. So we front-loaded our students before they went out with their mentorship program at the time, paired with a nurse in a rural community, and they were in different spots all over Saskatchewan, BC, and Alberta, and they're paired with a faculty member that regularly checks in with them weekly and all the time, more so if they have concerns. But when we send you out, we kind of give you a foundation of like emergency care, obstetrical care, palliative care, all of these things that you're going to see within these communities. So in the presentations that kind of wrapped up the end of the course, I was just so proud and excited of the experiences that the students had there. And then when I was writing down keywords, I was hearing all over, what an experience. Can't wait to go back and work there. Didn't think I'd like rural, and I was so surprised. This is definitely for me. And they have just developed such a passion for it and come back and just really appreciated for it. It was honestly, it was so exciting to teach.
Aw, thanks, Kate. And just like Kate mentioned, our students in the nursing program go all over the province or even into other provinces. So our first clinicals are often based right in Medicine Hat because we like to be nice and close to home. But then we're sending students to Brooks. We're sending students to Oyen, to Saskatchewan, to British Columbia. And exciting this year, we're actually sending students up to the Yukon. We've got our fingers crossed. So we're really trying to get everyone to their home, if that's not in Medicine Hat, or to any other rural experience that would work for them. So at Medicine Hat College, we're trying to give you the best opportunity to go to the most unique areas that we possibly can. Oh, and in the picture there is also simulation. We have a very robust simulation program. And what that means is students get to come into what looks like a hospital room, for example, and they get to practice all these skills and things that they're learning in a really safe environment where you can't do any harm. So students can make mistakes, they can learn, and it's all safe before they go and actually practice on a real human. So it's a really neat experience. And you see our students there in the picture, they've got some gowns on and a mask on. So maybe they're dealing with a COVID patient, hard to say, but it's a really wonderful learning opportunity. So just quickly to wrap up for nursing, we've only got one cohort in Medicine Hat, and we always start in September. So if that's for you, that's a great option. And if you're wondering what tips we can give you to get into the nursing program, we're looking a lot of what courses you've taken in high school. So if you're not quite sure, we'd really encourage you to focus highly on your biology 30, your English classes, math 30-1-2, and then either chemistry or science 30. So really encourage you to focus on those classes, and that'll really help you with the admission process. So we'd love to see you come to Medicine Hat College and become the next generation of healthcare workers. We've got lots of programs. So we've got healthcare aide, practical nurse, and nursing. And as well, we also have paramedicine or paramedics that we haven't talked about today, but they're certainly there if that is for you as well. So thank you for listening to our little presentation. We'll be here to answer your questions if you have any. We're super excited you're interested in rural health in Alberta and wish you the best of luck in your journey ahead.
Awesome. Thank you so much. We do have one question that popped up into the Q&A specifically for Medicine Hat. And then there was a question for Lethbridge that we can address after in just a minute here. But I do think that question will probably apply to most folks. So if you have other questions, feel free to pop them in the Q&A. But the question here was, in Medicine Hat, are there clinical or practicums within the first year? So I guess that also depends on the program.
I'll speak for the nursing program. In our new curriculum, we don't have clinical in the first year. We save that for the heavy part of second year. So lots of clinical in second year. First year, it's all your foundational courses. So a little bit different than maybe what you'd see at Lethbridge.
And in the practical nursing program, in the first year, you actually complete 2 separate clinicals, 2 of them being in the long-term care setting, and then a final one you move into the hospital acute care setting.
And if I can speak from a healthcare program, it's only 8 months. So yes, you will have clinical time during those 8 months.
So definitely depends on the program and what that looks like, but all some really great experiences. Right. I'm going to give you just a second here to, if anybody else has some questions for Medicine Hat, you are welcome to unmute really quick too, if you're feeling brave.
Hi, this is Joyce Wicks. I'm feeling brave, Alicia. I have a question is that how are you managing to do the dual credit now that's gone to 8 months? I'm on the CAC for Red Deer Polytechnic in Old College, and in our central area, we haven't figured out how to do dual credit when it went from 5 months to an 8 month to fit it into a high school semester.
Carol, you want to take that or do you want me?
Go ahead, Erin.
All right. Well, Joyce, so dual credit is brand new to Medicine Hat. This is our first year doing it in many years. So right now, the way we're offering it, we're doing kind of one course at a time. So if the students want to take all the courses we have to offer, they'll be halfway through. So they'll come, once they graduate high school, they'll come to Medicine Hat College to finish, I believe, the last 4 courses, which includes the final preceptorship. So they can't complete it all during high school yet. That's our goal, but we're not quite there yet.
All right. Are there any other questions for Medicine Hat College before we ask Lethbridge College for their couple questions here, and then we'll hop over to RDP. What program is to become an RN?
Yes, that's our Bachelor of Science in Nursing program. So that's the 4-year program that starts in September.
Perfect.
I have a question. We are a homeschooling family, and I was just wondering because I noticed that you have the official high school courses like Biology 30, and is there a different path that you can use as a homeschooling family to enter, or do we have to have those specific courses?
Yeah, we have a very specific admission process, so it would have to be those same courses.
One of the questions really quickly for Lethbridge was, and it probably applies to all of the post-secondary institutions in Lethbridge. Can you start in the 2-year diploma program and then apply into the 4-year degree program? And if so, how does that work? Would you enter into year 3 or what would that transition look like?
That's a great question. So at this point, we don't have a pathway directly from PN to BN, but it's definitely something that we're looking into. And I think it's an important initiative in Alberta in general is how can we provide healthcare professionals those opportunities to go back to school and streamline that education experience. So right now, what I've seen quite a few students choose to do that did the practical nursing program first is come into our after degree program. Often they'll have done some courses through the University of Lethbridge in the public health program, convocate with their public health degree, and then come in to do the after degree program in 2 years. I still think there's opportunity in the future to streamline that path further, though. So it's definitely an ongoing conversation with Loretta and myself and our leadership team is, can we create a PN to BN bridging program in the future? So stay tuned. Hopefully in the future, I'll be able to tell you about that program.
All right. And just because we do, is that the same across different institutions, handing it maybe over to Medicine Hat College or RDP folks who I know you haven't spoken yet, but just wondering if there's a difference there.
Yeah, for Medicine Hat College, we also don't have a PN to Bachelor of Science in Nursing bridging program yet. We're working on it, but don't have a timeline for when that might happen. If our students want to get into the nursing program or into a nursing program, often they'll go to Athabasca University, who does currently offer a bridging program. So that's a great option for online courses as well.
Perfect. And then there was a question there. What is the difference between working as an RN and versus LPN?
I'm really lucky because I've had the opportunity to work in both programs, and I do work as a registered nurse. So really what it comes down to is about our training and our scope of practice. So as a registered nurse, we do have to have a degree to be eligible to write the NCLEX exam, and that has a registration under the scope of practice. That's a regulated profession in the province of Alberta. Similarly, so is a licensed practical nurse. The difference is in your schooling and your academic time that you spend in is basically 2 years versus 4 years. And it's really sometimes the depth of knowledge that you go into in the theory base, specifically in the RN program. Both of them are extremely vital part of the healthcare atmosphere overall and the care that we provide for patients. And on the average unit, I hear many people say, well, there's no difference between them. But honestly, there is some. On a general medical surgical unit, you may not identify with it as much, but when we get into specialty areas, you are having more RNs there. So it kind of depends on what you want to do, how fast you want to be out of school, and sometimes where your marks are, where you're able to get in. Erin had mentioned before too, we do get a lot of people, like friends of mine or people I've worked with, past students, that are going with the Athabasca route right now because they can do it online. I think it's like 1,300 practice hours you need, and you can also study at your own pace with it right there right now. So if you wanted to get into some like specifics about where you want to work or a role as a nurse, it would make a difference there, and the salary does reflect it as well.
Thanks, Kate. So Victoria and Kelsey, I'm going to pass it over to you.
Excellent. Thank you so much. So Victoria and I are here today. My name is Kelsey and I work with the Health Grade program, and Victoria will speak about the practical nurse program. Let's see if I can share my screen. So Red Deer Polytechnic, or previously Red Deer College, which you may know it as, it recently went through a name change. It's been a couple of years now, but I know many still refer to it as Red Deer College. Obviously, we're located very centrally and have a big rural focus in a lot of our programs. We do offer a health grade program, practical nurse program, as well as a BSCN program. Without providing too many details too, there is a BSCN or PN to BSCN transition program. That information is located on our RDP website if you want some more details. I didn't, or Victoria may be able to speak to it as well, but I don't have as much details with me. So I'm going to start by talking about health grade. It's actually very similar to what Medicine Hat College talked about, as we use a Government of Alberta curriculum. So very similar, just some slight differences in how we deliver the program and just because of where we're located. All right, so health grade certificate, as others have mentioned, health grade is a really integral part of the healthcare team. They work in really those direct client facing settings, things such as home care, assisted living, long-term care, and acute care settings in some cases. It is an 8-month certificate program, much like Medicine Hat College has outlined. So we do 2 terms. The interesting thing about with our health grade program and kind of our reach with rural, which PN does as well, we offer HCA and PN in our rural communities. We offer them really throughout Red Deer Polytechnic and then throughout our surrounding communities. So sites such as Ponoka, Stettler, Drumheller, Rocky Mountain House, Sundre, Olds is places where we offer this, usually on a rotating schedule. So we have information on our website about when those are offered. Typically we have Stettler and Ponoka in January, and some of our other sites mostly in the fall. Our Red Deer site does have intakes 3 times a year. So we have intakes in September, January, and in May. So lots of opportunity to enter the program if you're interested. This is just kind of an outline of the 2 terms. So, one of the important pieces that with this, we do a mix of theory, lab, and clinical. So our theory is currently all virtual, so lots of flexibility that way. We have in-person labs, whether that be in Red Deer or at those rural sites that we're talking about. So if you're taking it, say, for example, in Stettler, you'd be able to go to that rural site to do your labs. And then same with our clinical placements. So clinical placement 1 and clinical placement 2 are both instructor-led group clinicals. We can place individuals in Red Deer, but we often use our surrounding communities as well for our rural communities, especially if we're somewhere such as Stettler or Sundre. We try to use those sites in those communities so that you don't have to travel, and we can, you can kind of really get a chance to understand, what is there, what are the needs of that community. So, and then in our consolidated clinical placement, which is that course 9 or the final course, this is where individuals actually really get to choose kind of where their interests are. So if they took the program in Red Deer, but they are actually from, Northern Alberta, they would have that opportunity perhaps to take that placement to do their consolidated clinical placement there. Some high school courses needed. Like I said, this was outlined before, but if you're looking to, where you're at right now in your high school career, we do ask for, or you will need an English 20-1 with at least a 60%, or if you do have an English 30-1 or 30-2 with a minimum of 55%. There is English language proficiency, so if you're not taking your English in Canada, there is still an option to take English language proficiency testing. We ask for digital literacy. And with health grade, there's also the option for AccuPlacers. So if they're, perhaps post high school, the marks maybe weren't what you wanted, or maybe you're a mature student, somebody knows a mature student, there is an option for an AccuPlacer, which is kind of like a college board entrance exam. So if you don't have these English courses, there still is an option to enter that workforce or enter the program. Some interesting additional information about our program at Red Deer Polytechnic is that we do actually have some opportunities for RDP Rural Learner Support Grants. So this is for learners, specifically for learners that are in rural sites attending programs. So like I mentioned, Stettler, Ponoka, Drumheller, Rocky Mountain House, Sundre, I think I said Drumheller. There's an opportunity for some grant money. So to kind of help and promote you going to those rural sites. So those are available for healthcare aide and practical nurse students. For additional information, if you're really specifically located rural and you're looking for rural, a site, or you're looking to stay in a community, watch for CAC open houses. So CAC is our Campus Alberta Central. So it's essentially a partnership with Red Deer Polytechnic and Olds, and we have sites in those areas. So where you essentially can, have the same benefits of an RDP student, but just in your rural site. So these are often held in April and May. The sites do a really good job of advertising. So if you're located in one of those communities, try to pay attention to radio, newspaper. They usually try to advertise that way, as well as we advertise on our social media and on our websites. I'll just touch quickly too, as people are talking about dual credit, there is an option for dual credit Red Deer Polytechnic that just is going through a pilot phase right now as of February. So we are trying to I think Joyce had mentioned there has been a change in dual credit, but we are trying to offer that again now, with it being a little bit of a longer program in 8 months. So we have some partnerships as a pilot with some school divisions in the central zone. And we're starting to offer that. We're just starting on a course by course basis. They're starting with one course. Often students are entering or encouraged to enter in their second term of grade 10. So this may, if you're located in the central region, you may have already seen some information come up about this, specifically if you're with Red Deer Catholic or Chinook's Edge or Wolf Creek School Division. They suspect that it will be offered again, so just keep an eye out for information from your school. So there is an option for dual credits that you would finish your high school with either with some courses and then be able to enter into the health grade program, or we're looking at opportunities for them to finish the whole certificate. So for any questions, I'm happy to answer. You can reach me via email, and I think that information has been shared out to you for afterwards as well. So I'm going to pass it off now to Victoria.
Now I'll try to share my screen. First, I would like to talk a little bit about where practical nurses can work after they graduate. So acute care hospitals, rural and city experience is a little bit different for LPNs. In rural hospitals, they tend to do much more versus city hospitals. When I graduated from my PN diploma, I worked in Calgary, and emergency departments were out of question for LPNs. They're still out of questions for LPN, labor and delivery as well. If you work in rural community, you work everywhere. And our students can assist with labor and delivery, and they actually work in emergency departments. You can also work in long-term care, which is nursing homes, home care, where you go and visit sick people that need your care in their houses. You can also work in clinics with the doctors, specialized clinics or family doctor clinics. Public health is also accessible to us, immunization clinics, for example. And travel nursing is something new that is emerging. And for LPNs, we can go to another provinces and work for some time or actually move there. So what do? We provide nursing care for patients, families. We deliver health education programs. We teach practical nursing and use skill and knowledge to assess patients' needs. Our program is run in 6 terms, so we did stretch it a little bit to lower the load and the intensity, and students tend to like it. We'll have 3 clinical placements throughout the program. One is going to be in long-term care or nursing home. Second clinical placement is in acute care, and then those both clinicals are instructor-led. And then the final clinical, where you do your preceptor shift, you're going to be working one-on-one with a nurse in a placement that we try to provide based on your preferences. So all our theory courses are delivered online, with very few that are hybrid delivery mode, which means you can choose if you want to be in a classroom or if you want to join a class from your home. Labs and clinicals, of course, in person. We didn't figure out how to teach labs online quite yet, not that we really want to do that. So when we look at the clinicals are either in the nursing homes or hospitals. So if you are designated to do day shifts, you're going to be working from 7 o'clock in the morning until 3 o'clock, and evenings, it's evening shift from 3 o'clock until 11. For rural students, we do try our best to keep you in the same community, but it might be a hospital in the community nearby, so driving to site might be required, which means if you think about joining practical nurse program, maybe think about getting your driving license as well. We do have uniforms, and for us, it's an eggplant top and then black bottom. What's so special about RDP and PN program? We actually deliver those programs in our 4 rural sites, so Stetley, Rocky Mountain House, Drumheller, and Ponoka. What do we do there? So you would join classes, theory classes online from your home, or you can go to CIC site and use the internet to join classes online. And then your lab will be on CIC site. So it's going to be, for example, in Stettler. And then the clinical, of course, will be in Stettler or in a community close to Stettler. Labs usually 1, maximum 2 days a week, which means if you live close to those communities, you don't need to go to Red Deer to take practical nurse program. I'd just like to share a student testimony that we recently received. She is from our Stettler CIC site, and she's graduating from practical nurse program this semester. And she's saying that being able to do my course through the CIC gave me ability to continue living and working rurally. The CIC office has been the best and most helpful, has the best and most helpful staff, which has positively influenced my learning. From application to the program, advice and testing services, the CIC has been a huge asset. Without the CIC, I would not be where I am today, education and career-wise. I would greatly recommend this program. Couple years ago, Prairie College also joined RDP. So what they offer is 23-month program, and students that graduate from Prairie College, they get 2 diplomas. So one diploma is in ministry, and the second diploma is practical nurse diploma. So practical nurse diploma is delivered through the Red Deer College. So it's a Red Deer College curriculum. I'd like to touch base on some helpful tips how to succeed through your college life. So we do have lots of support on campus, like counseling services. We offer tutoring. Library offers multiple services, including helping with research and writing your papers, and you name it. We also have student success services. So knowing the resources and accessing them on time helps you to succeed. Even if you live in Stettler and you take in program through Stettler CSC site, or if you live in Rocky Mountain House and you're taking your program there, Red Deer main campus services are available to you. Consider it Red Deer College Polytechnic student. Another helpful tip can be forming study groups to study with your peers. And also, if you are taking program through CIC site, as our student mentioned, there are lots of resources that are available to you. You just need to know what they are and use them. This slide just summarizes what is included in the cost. So the tuition for domestic international students is different. The cost is changing. So for most accurate information, it's better if you access RDP website. We also ask you to purchase books and lab supply kits. They are available to purchase at RDC campus store, RDP campus store, scrubs and shoes, personal computers and laptops. And there are also some additional fees like student association fee, activity and wellness fee, health and dental plan. Something to consider when you're applying for the program. As Kelsey mentioned, we have several awards and scholarship opportunities. So I listed 3 here. They are designated to rural students specifically. And for example, health science rural practicum bursary to offset the financial burden of traveling to a distant practicum location. So if, for example, you live in Stettler and you placed in clinical in Tree Hills or Old, you can apply for the bursary to cover your traveling cost. Rural Learner Support Grant available to our all rural PN students, and we also have accessible work integrated learning bursary also for traveling to a distant practicum location. So our program requirements, we don't have competitive GPA anymore. So it's just first come, first serve really admission. You will need 60% in English, 30-1. You will need 60% in biology, 30. And for math, you have multiple options. So you can look through that and see which one would be applicable to you. And of course, if English is not your first language, you would have to go through the English proficiency exam. We also have some clinical and health and safety requirements in addition to admission requirements. So you will have to do some training through the Alberta Health Services to be able to access the hospital. You will have to do vulnerable sector check through the police, the immunization status, respiratory fit test for the mask and 95, and also Heart and Stroke Foundation basic life support to enter the program. So for the upcoming PN intakes, we're going to offer our program in Stettler and Rocky Mountain House in September of 2024, as well as Red Deer intake in September 2024. Panoka and Drumheller, we took them last year, so the new intake for Panoka and Drumheller will be in 2026. Open house for RDP is going to be in March 23rd. If you're interested, please come. You will get more information and a feeling what it's like to be an RDP student. And just to touch base on the bridging from LPN to BSCN program. So we started offering that transition program. So it is 1 year certificate. So you graduate from your PN program, then you can apply for the transition program, which is 1 year certificate. And upon completion of that program, you will enter year 3 of our BSN program that is also offered at our campus RDP. That's all I have to say about PN program, but I'm happy to answer any questions you have now or at the end.
Thank you, Victoria and Kelsey. I know that you did mention the BSCN program there. I don't know if Erin wanted to touch a little bit on that, or I mean, it is a 4-year degree. And can you remind me again, is it through the U of A that it's a collaborative partnership?
That's correct. Yeah. So it is a collaborative partnership with the U of A. However, not unlike the Medicine Hat program, you would be able to complete your degree in Red Deer. So you can do all your 4 years there and you would get your degree from the University of Alberta. Yeah. And I guess another difference, people were asking about whether they started clinical in their first year. With our first year of our degree program, we do not have clinical either. We do kind of all our foundational courses the first year as well. And then you would move into doing clinical in the second year.
What would be the benefits in taking English 30-1 over 30-2? Same with math, as in and in sciences, post-secondary institutions list Chem 30 or Science 30. Would you recommend one or the other? And are all of these courses viewed the same when students apply?
I don't think there is a big difference. It's usually to recruitment, register office, they would have better answer to that question. But if you planning to advance your education, if you're planning to apply for BSN later, it's probably a good idea to take -1 courses. So you don't need to go back to upgrade later. But for RDP, we don't have competitive GPA anymore. So whatever is listed, if you have it, sure, you can apply.
I am going to welcome our post-secondary students to the call. So we have Eva Wiebe and Georgia Heisler, who are nursing students at Lethbridge College. We have Travesty Tachik, and she's an HCA student from Medicine Hat College, and Megan King attends Red Deer Polytechnic. So I'm going to start right up at the top again. We're going to go to Eva. So Eva, if you want to share your story, then we'll go to Georgia, Travesty, and Megan.
So I got to spend my last semester, so fall, so September to December 2023 at the Tabor Health Center as a student, and broad scope of practice. One day I got to help with end-of-life care. Oh, here, I can start my video. Okay. So, as I was saying, so one day I got to help with end-of-life care, and then the next shift or the next week, I was helping with like a postpartum mom and a new baby. So the scope of practice is very broad, really, really good exposure and experience for me as I live in Tabor and most likely will work in Tabor because this is my community. But overall, I really enjoyed it. I think that's all that I had to say. Glad I got to share. Thank you.
Awesome. Thank you, Eva. And Eva, you are in the BSCN program, is that correct?
In the NISA program, so the Bachelor of Nursing out of Lethbridge College, yeah.
Perfect. Thank you. And Georgia, I'm going to turn it over to you.
Just a little blurb about my clinical experience and how I moved to Lethbridge. So just going to start off by introducing myself. My name is Georgia Heisler. I'm in the second year of the NISA Bachelor of Nursing program here at the Lethbridge College. And a little bit about me. I was born and raised in Southern Alberta. I grew up on an acreage east of Medicine Hat and graduated from Eagle Butte High School in 2021. During my time in junior high and high school, I did not know the exact path I was going to follow in post-secondary, but I knew I wanted to have a career where I was working with people and making an impact on their lives. I always had an interest in working in healthcare, but I did not know exactly how I was going to follow. 1 year after I graduated, I was taking general sciences at Medicine Hat College and talked with a friend who was in her second year of the NISA program. After hearing all the opportunities the students were able to experience, the Lethbridge nursing program had all my attention. I got accepted into the program and moved to Lethbridge to pursue my degree. After living in the same house my whole life in my little community, moving to Lethbridge was an adjustment, but I was so excited I adjusted pretty quickly. I've met lifelong friends within and out of my program, and I'm currently loving what my program has to offer. Now to fast forward to the busyness of second year. I had my clinical rotation last semester in Cardston Health Center. We got an in-depth tour of the hospital that included the med-surg and acute unit, where we spent most of our time, day surgery, ER, laboratory, and x-ray. The staff there was so kind and eager to teach us, whether if that was the manager coming to us and talking to us and offering us supports, or the maintenance manager making us feel like we were part of the family there. They shared some of the differences between urban and rural facilities that varied for some beautiful components to definitely some challenges. In my theory class, we had a week's lecture on rural nursing. The reality of it does not apply until you're there. You're part of the whole community in itself. Growing up in a small community and really living and valuing those dynamics, you pick up on some of those same similarities. The nurses and other disciplinaries have a broad scope of practice. Nurses are trained on both floors and units in Cardston, which is something I really loved when I was there and something I'm really interested in my career. We were primarily in the acute and med-surg unit in Cardston. I got to see a variety of acute and chronic conditions and disease processes, which allowed me to practice many skills I learned in lab at the college. Patients varying in health and age helped me progress my practice as a nursing student, especially in my communication in the clinical setting. I had the opportunity to spend both shifts 1 week in day surgery. I got to follow and care for multiple patients through the entirety of their stay. This included pre-op doing questionnaires, the prep work, the scrubbing of the surgical sites and wheeling them straight down the hallway, inter-op, which was watching the surgery and learning and asking questions directly to the anesthesiologist, the surgeon, and more nurses. Then to recover, taking vitals, managing some post-nausea, doing post-op care, and discharging and seeing them go home. We got to spend a day in the ER learning about emergency treatment and interventions in a trauma bay. My clinical instructor was eager to share his expertise. So as a clinical group, we casted one of my clinical members' arms in a few different ways for different rationales, and then we actually got to saw it off. This was more for learning purposes and lighthearted fun because my instructor was an ER nurse, so he was really pumped about that. The x-ray technicians there were excited to share their profession by showing us imaging and getting us students involved by holding and mobilizing patients during their pictures. Overall, I'm so thankful for these experiences I was involved in. Being in a smaller hospital where my instructor pushed me to do my best and take advantage of these learning opportunities allow for lots of diverse practice and patient care. From this, I got an in-depth learning and understanding of my patients, their conditions, and what I could do personally to improve their care, even if it was something as simple as giving them a shower. As a nursing student, I feel my skills were greatly impacted from my rotation. I learned the value of time management, safe patient care, and a better understanding of how health facilities operate and working within an interdisciplinary team. Within my small rural clinical group, I learned the value of teamwork, which I truly think is the heart of rural nursing. Overall, I gained more confidence in myself and found a love for many different domains of nursing. I got to see and experience different specialties, and for that, I'm grateful for. Thank you, everyone, for listening. And if you have any questions for me, I'd be happy to answer them.
Thank you, Georgia. That was some fantastic story sharing. And yeah, it sounds like it's been a really great fit. So I can't wait to see where you and Eva as well go in your future careers. All right, we are going to move to our next speaker, Travis T.
Okay, so my experience has been a little bit different. I was able to take the supportive care assistant program. So I did that online. I could do it at my own pace while I worked my past job, which was Dairy Queen. I'm 48 years old. So I started life a little bit differently. Whole new career change at 48. I was able to work in the field on a casual basis at a nursing home. So they ended up hiring me on casual. So then I enrolled into college, started the health grade program. And while I'm doing my clinicals, I can still pick up shifts casually. So I'm still earning a wage, whereas our clinical experiences are not paid for. My advice to future students is jump right in. It's very fast paced. Lean on each other for support because you're going to need it. You're going to have good days and bad days. Money it costs a lot. Textbooks are expensive, scrubs are expensive, you need a laptop, but the colleges are there to support you. Lean on them, access your services, and the instructors are wonderful and amazing, and jump right in and be prepared to learn. Ask questions. I mean, I'm 48 and you're never too old to learn something new. But if anybody has any questions, reach out to me. I'm there to answer them, help you out the best I can. And I just want to say thank you to Carol because she's been amazing from day one.
We are now going to move to Megan King, who is taking her program at Red Deer Polytechnic. So I will pass it over to you.
Hi, my name's Megan. I'm a mom of 2 little girls, and I'm currently I'm a second-year student with Red Deer Polytechnic in the practical nursing program. I was born and raised in Red Deer, Alberta, and relocated to Black Falls area 3 years ago. I chose to enter into the nursing field because I have always been fascinated with the human body, and I enjoy caring and being there for those who are vulnerable. I have 6 years experience of working as a healthcare aide previously. With my current placement, I've been placed at Panoka Hospital in acute care clinical, and this placement has been absolutely thrilling. I've seen so much in the past 6 weeks, from diabetic ketoacidosis to hearing a baby cry that was just born. You name it, it's just so wonderful. The staff have been very supportive and welcoming. The rural atmosphere is just contagious. So I really would like to work rural. It's definitely on my radar and will be in my top 3 placements for my preceptorship. If you could, I would highly encourage working rural there because there are a lot of opportunities and there's always a need for any profession related in healthcare. Another bonus about working rural that I don't think anyone has touched on is that you get $4,000 paid towards your federal loan each year, and then an additional $1,000 after that for up to 5 years. So I think that's a great little benefit, and just being rural and being within that community it's just so fun, and I enjoy it so much. So thank you so much for listening.
Thank you, Megan. I'm going to go through the Q&A questions now. So the first question that we have is somebody had asked, I noticed there was a nursing prep program at U of L. So what is the nursing prep program? If somebody from U of L wants to speak to that.
Sure, I can speak to that. So we do have a variety of students that want to upgrade some of their courses they took at the high school level and then come into the Bachelor of Nursing program. So they could pursue that option through the U of L. And the same advisors that work with our nursing program also help support students while they're in the nursing prep program. So we do see quite a few students come through that route. And I know earlier one of our student speakers spoke about coming into their health program a little later in life. We do see students come with very diverse backgrounds into our nursing program. So that's one of the pathways they can do that successfully if they have some courses they need to take.
The next question we have is, what have been the high school averages that each college have been accepting for admission? I understand their requirements, but know that averages that are accepted are much higher. So again, maybe with a little bit of that competitive GPA piece, but if you could, I don't know who wants to speak to that first, but maybe I'll pass that back over to you.
Again, our admissions for the Bachelor of Nursing program occur through the U of L. Typically, we have quite a competitive applicant pool. So averages typically are 85 to 90% to enter into our programs. And we have a lot of applicants every year, so lots of demand for our programs. We have expanded our seats though in recent years, and we've talked again this year about potentially expanding our seats. So sometimes when we go through a seat expansion, perhaps we would drop our competitive average slightly, but yeah, definitely keep working hard on those marks to pursue nursing. And then our practical nursing program doesn't have a competitive average at this point in time. So if your grades potentially don't quite meet the benchmark for the Bachelor of Nursing programs, you could also look into the practical nursing program at Lethbridge College.
Perfect, thanks. Erin Murdoch, do you want to add something from Medicine Hat?
Yeah, so very similar to what Liz just described, we are competitive entry for the Bachelor of Science in Nursing. So while it looks like you maybe only need potentially a 60% in a specific class, we do take the people who have the higher averages. So typically, just like Liz said, between 85 and 90% is what you would need to be accepted into the nursing program. But do know, so if you're in high school and you're in grade 12 and you've completed maybe your first semester, or you're still in your first semester of grade 12, we will look at your grade 11 marks and potentially offer admission based on those, as long as you maintain that high average throughout grade 12. And then our PN program is not competitive entry, very similar to Lethbridge College. So as long as you're meeting kind of our minimum guidelines, you potentially will get into the program as well.
I would echo both Liz and Erin in the competitiveness for sure of the BSEN program admission, right? The marks, again, that 85 to 90%. So definitely, and we do tend to take the students that are at that level. So yeah, the same. And then Victoria was mentioning the non-competitive first come, first serve with the PN program.
So the next question is, within the nursing workforce and classes, is there a female majority or is it evenly split?
In PN program, we have mostly female nurses. We also have few male students, and we also started having a lot of international students as well.
I would say it's certainly, heavy in the female portion, but there is more and more male students, it seems, every year that apply. I know right now, a lot of my students, I have quite a few male students, and certainly international students as well. So, but yes, definitely female dominated profession still.
I think we might be slightly different then. So I've really seen the growth in male students as well as faculty in our programs. So a third of our faculty at Lethbridge College are male instructors. And that's in the BN program, and similar for the PN program. And then I'd say this year, about 20% of our four-year program students identify as male. And then we have an after-degree program, like I mentioned earlier, where we see quite a large portion of male students as well. So out of that 32 seats, this year we have 8 students. So yeah, maybe a bit more gender diversity in recent years that we're seeing. So.
We're very much like Red Deer. Maybe 10% of our nursing students are male, which is an increase from what it used to be. When I was in nursing school in a class of 400, we had maybe 2. So we do see that's an increase. And the PN program, oh goodness, out of 56 students, maybe 2 males. So not a very high percentage, but we'd love to see more men enter the nursing workforce. That would be amazing.
The next question is, I guess, for the healthcare aid program. So grade 11, can you completely finish the healthcare aid program in grade 11? So I guess that would be the dual credit that they'd be looking at.
I will take that from the Medicine Hat College perspective. So unfortunately, not at this point in time. If you're starting the healthcare aid courses in grade 11, you'll be able to finish most likely half of them. So there's 8 courses in total. So you should finish 4 by the time you graduate high school, and then you complete the last 4 with us at the college. And that's just how we've mapped it out, because we're brand new at doing dual credit. So it might change in the coming years, but at the moment, the most you could have is 4 courses completed.
I think it was just Medicine Hat that spoke to the dual credit, if I'm not mistaken, or
is doing a pilot this year with it as well, but I would say it's not would not be able to finish in grade 11. The path would be to start in your second term of grade 10 if you were going to look to complete all courses, but you'd be looking at ending in grade 12 just based on hours required and being able to complete your regular studies. So I would believe the answer would be no to that.
The next one is, are all of the nursing diploma and degree programs still open for fall applications in 2024? I'm seeing a whole bunch of nods. Yes. Okay. Yes, please apply. Next question. If I am interested in the surgical field of nursing, and there was actually another question that was similar, a certain nursing program for children's or pediatrics, which nursing degree would be the most beneficial to take? So I guess if there is a difference between those specialties, the first question is about surgical, and the next one is children's or pediatrics.
I can speak to this one. So I'm a child health nurse, and there's definitely opportunities for both practical nurses and RNs to work in child health nursing, whether it's in some of our rural cities or in places like the Children's Hospital. In terms of our program and sort of the exposure you get during our curriculum, so with our 4-year degree program, all of our students will do a 6-week placement in a pediatric floor in the second year of their program. Again, that's where I teach, so I'm going to put a plug in for that. And a couple of students on our screen right now are doing these placements at the moment. And then in terms of the surgical workforce, so we do see, again, practical nurses as well as registered nurses working in surgical floors, whether they're with adults or with children in a variety of settings. In our 4-year program, students will primarily go to their surgical rotation in the 4th year of their program, and that will be for 6 weeks as well. But just as Georgia and Eva mentioned, is in the rural hospitals, you might get an opportunity to see some surgical nursing there, or when you're on another floor like labor and delivery, there's C-sections that are a surgery, or pediatric patients that might go for surgery as well. So there are other opportunities for those exposures. And then the practical nursing curriculum, they'll do a surgical rotation as well, so approximately 6 weeks. And then they don't do a pediatric placement in Lethbridge, but they do a course and potentially could do their final preceptorship in a pediatric setting.
Excellent, thank you. I'm going to pass it over to Erin Murdoch. Did you want to speak anything there to Medicine Hat College in terms of those pieces?
Yeah, absolutely. So very similar in our practical nurse program. Our students focus a lot on acute care surgical units. So looking after people who have had surgery and have come back to heal and get better. So that's a big focus. And they also do a pediatric course, but don't have a pediatric clinical attached to it unless they go to a pediatric unit for their final preceptorship. And as far as working in the operating room, so actually doing the surgery itself, LPNs absolutely can do that after they graduate. With a bit of extra training, they become what's called an OR technician. So it certainly is within the LPN scope of practice, and it's great to see LPNs in the operating room. So that's an option with a bit of extra training. And then for our nursing program, the Bachelor of Science in Nursing, our nursing students do have pediatric rotations in either their 3rd or their 4th year, and they can have a rotation on a surgical unit anywhere from their 2nd, 3rd, or 4th year as well. So lots of exposure to looking after people who have had surgery. And similar to LPNs, once an RN graduates, they can certainly work in the operating room with a little bit of extra training.
And then there was a question about how many seats for the Bachelor of Science or the RM program for the program at each college. So how many seats are available in the year?
They keep changing it. So we keep adding seats because we need nurses. So I want to say 120. We do like a fall intake and then a winter intake. And I honestly can't think of the exact numbers, but I want to say around 120. And then there's another 48-ish maybe in the winter intake. So, and that number's kind of been fluctuating, more and more just with the increase in seats with government funding. So, yeah.
So we take 160 students between the Bachelor of Nursing and Bachelor of Nursing After Degree program. We have been talking about expanding further. And then the Practical Nursing program, they typically take 110, and they're also looking at expanding further. So there's such a demand and many more applicants than we're able to take into the programs. So yeah, just always looking to grow and kind of meet the healthcare workforce need in Alberta.
So for Medicine Hat College in our nursing program, we have 72 seats for a September intake. For the practical nurse program in Brooks, we have 56 seats. And for the brand new cohort in Medicine Hat, we have 32 seats with the January start. And then for Healthcare Aide, we've got 32 seats for Medicine Hat in person, 32 seats for January intake online. And then our Brooks intake is 16 students.
There is a question about becoming a paramedic. So I believe that may be a different degree, but I am not familiar with the degrees for that. So if someone can speak, maybe I'll pass it over to Erin Murdoch. I see that you're nodding to that one, so maybe I'll let you take that.
Sure. So sorry, what was the question about paramedics?
Just wondering if they were looking to become a paramedic, what would they take for a program?
Yeah, so our program at Medicine Hat College is a little bit unique compared to maybe SAIT or NAIT. So right now it's a 3-year, what we call applied degree. So you do all 3 years at Medicine Hat College. to become what we call an advanced care paramedic or ACP. And then we do have a 4th-year option that you do completely online on your own time to get your full degree. So really unique in Alberta. No one else really offers it that way. And we're partnering actually with people out in Ontario to get them kind of on board. So it's a really unique program. You can also exit after 2 years to become what we call a PCP or a primary care paramedic. But if you do the full 3 years, you become the advanced care paramedic.
We do have a primary care paramedic program at Lethbridge College that's offered in conjunction with NEAT. That isn't my program area, so I don't know all the details about it, but I know it's a very popular program. So definitely with the package that goes out after this meeting, some of the same contacts for nursing could also help you to look into that option in Lethbridge.
Perfect. Thank you. All right. And then I know that there's a question here. Are all the 4-year programs, the 2 years at the college, 2 years at the university? I believe that the 4-year programs, are they all within the community that you take them in? Like for Medicine Hat, Red Deer, and Lethbridge, do you remain at that institution or do you have to go over to the university at any point?
So our program, I think, is unique compared to the other 2 programs where our students spend their first 2 years or 2 semesters, if it's the after degree program, on the Lethbridge College campus. And then they do a transition to do years 3 and 4 or their final terms, if it's the after degree, at the university. So they get kind of 2 campuses for one, is what we always say. They have library cards at both. They can access the gym and facilities at both. So they get the opportunity to kind of meet faculty that primarily work on each campus at some of our different events. But they will spend time on both campuses for their theory and labs. But years 1 and 2 at the college.
Yeah, so our nursing program is all in Medicine Hat, all 4 years. We actually don't like students switching between campuses, so just be prepared if that's your idea. University of Calgary might deny you. So you do all 4 years at Medicine Hat, which is really nice. You get smaller class sizes, you get to stay kind of within the general community around Medicine Hat with some rural placements. We're not in big competition with Calgary, like in a big city with lots of different hospitals and stuff. So it's a much more intimate experience. And all 4 years happen in Medicine Hat.
RDP, you certainly complete all 4 years at the RDP campus. So yeah, we are there for the entire time. And I think I like the small class sizes when you talk about that, right? I think a lot of students choose a smaller institution for that reason. So rather than going to the University of Calgary or University of Alberta. So yeah.
Would it be possible to finish taking your healthcare aide degree during your RN degree and then work as a healthcare aide during post-secondary schooling?
I don't know about finishing while you're taking, but for the most part, you could work as a healthcare aide during your post-secondary schooling. I don't know if anyone wants to elaborate on that.
I was going to say at RDP, after the second year of the program, students can work as healthcare aides. So once they have a certain amount of practice hours in their practicums, they can do that. So yeah, and I assume it's similar for you, Erin.
Yeah, absolutely. So once you finish your second year of the nursing program, you can work as a healthcare aide, and we really encourage students to do that. It's a great way to just practice your skills, practice how to talk to people, practice work life, getting up for a 7 a.m. shift or an 11 p.m. night shift. So it's a good way to kind of break yourself into the profession. For our healthcare aide program, you couldn't take it at the same time as nursing. Your classes would just run at exactly the same time. So it wouldn't really be possible. But yeah, we really encourage our nursing students to practice as much as they can out in the field as they're going to nursing school if they can.
Just echoing what Erin shared, is our students can apply to the healthcare aid directory here in Alberta or in their associated province. Usually they need some proof of enrollment in their nursing program and completion of years 1 or sometimes years 2, depending on which province's requirements they're trying to meet. And we'll support them with that paperwork, and then they submit their transcripts as well. So it's a pretty seamless process. And I think on the healthcare aid directory, it gives you some really nice guidance for nursing students, how they can apply and get a healthcare aid job in between semesters or kind of on weekends around their busy nursing schedules.
Do you need to be certified as a healthcare aide, if I'm understanding that question? So is there any certification for healthcare aid that you need as well as, or can you say have your degree or whatever and use it as become a healthcare aide?
can take a stab at this, but I think healthcare aides are now more regulated than they were in the past. So probably my colleagues on the screen can speak to this, but with the healthcare aide directory and the process, I think if you were to start in a nursing program and decide nursing wasn't for you, you likely would have to meet some specific criteria to remain in the healthcare aide directory and to continue to function in that role. But again, that regulatory process would be something you'd have to look into.
That's a really, I think, accurate response. There is some PLAR that you would probably have to go through a process to apply for prior learning academic recognition to those courses, because with the healthcare directory, after you're not a student anymore, they would be looking for like health grade students do write a provincial exam. And are like a lot more regulated. We use a healthcare directory, so that would be kind of an interesting take for sure. But I think the healthcare directory and like Alberta Health would be able to kind of answer some of those questions. There would likely be some sort of path or some options.
With Medicine Hat College for the LPN program, can you work as a healthcare aide after your first year, or does that only apply to your Bachelor of Nursing? And Erin Murdoch from Medicine Hat College there replied there that PN students can work as an HCA after the first year of classes. So that is correct there. So there is a package of information that's going to be coming out. Thank you so much to all of our speakers. They have spent their evening with us. They also met with me earlier, and they passed on a lot of great information that I would love to send to you all. So if you checked off yes, you would like to receive follow-up information for this session on your original registration, then you will get that to your inbox. I'm happy to pass on the contact information that they shared, some view books and some links and some scholarship opportunities. So have a look at that. It should be some really great info. On behalf of RPAP, thank you so much again for joining us tonight, and I wish you all a wonderful rest of your evening.